I would like to introduce Dr. Asa Radix from Callen, Lorde in New York City, who's going to talk to us about PrEP in her clinic. Sorry.
Hey, good morning, everyone. How amazing it is to follow like these two inspirational speakers. So I'm going to be talking a little bit about it's a little bit about Callen, Lorde and how we rolled out PrEP and some of the challenges that we faced. So are you going to change the slides? Okay, great. So here they are. So I wanted just to talk a little bit about Callen, Lorde before getting into this. So we're a community health center in New York City, and so we provide care to a lot of people who are uninsured or underinsured. We currently, in 2014, had just over 3,000 clients of trans experience, and that included nearly 2,000 transgender women. And again, we do supply care to folks who often have no other options. So about 15% of our clients are homeless or unstably housed. Just over half of our trans clients are people of color, and almost a third are uninsured. Back in January 2011, the CDC released interim guidelines for delivery of PrEP, and we were so excited. We had been waiting for this, and we immediately created our own very easy to follow guideline. As you can see, and I hate to say I played a role in this. Our protocol did actually follow the interim guidelines almost word for word. We were very careful in making sure that we included eligibility that was transgender women. So we created this wonderful guideline, and then we trained our providers, and we waited to see who was going to come in. Unfortunately, in that first year, we provided PrEP to less than 20 people, and we didn't have any transgender women come in for PrEP. There were many barriers, right? There were barriers to accessing PrEP, the fact that many people in the community weren't aware that PrEP was available. There were financial constraints then because there wasn't the medication assistance program. People's sense of their risk was low, but at the same time, we were providing PEP to over 500 clients a year. So clearly, we definitely had like a client base to be getting PrEP. After that, we were quite lucky to get to work with Sarit Golub from Hunter College to start a PrEP demonstration project, which was Sparking PrEP Awareness, Research, and Knowledge. It's been a wonderful kind of asset to our clinic. I think one of the issues was that from the very beginning, we had wanted to include transgender women, but as you can see from the resources that we had available, we weren't really creating fully inclusive materials, I should say that, or materials that I think women would want to access. So, we're now in the third year of Spark. We have 245 participants, and only 3 transgender women actually enrolled in the study. One left the study, just left New York. One decided to stop PrEP, and we have only one client, only one trans woman who's currently taking PrEP. So, we wanted to start from here because we obviously recognized that we had a very big issue. So, we decided to really make a decision to scale up PrEP in our clinic. And some of the things that we did, we wanted to prioritize outreach specifically to people of color and people of trans experience. And we knew we had an issue because even in our PEP program, the majority of people accessing PEP were white gay men. And we really weren't having, even though our clinic is very diverse, there were certain subpopulations that were definitely not accessing. So some of the things that we did, we decided to we recruited people to join our program. We had 3 women of trans experience actually join our prevention outreach team. We had 2 trans women join us as LPNs. And part of what they did was, go into our sexual health clinics and start talking about PrEP to everyone, but really women in the community about what PrEP is, how it works, how it can work for you. Talked about, did everything from if someone was interested in PrEP, they went ahead and enrolled them in insurance or took care of, medication assistance programs. And we also have another program in New York City called PrEP App, which is an assistance program for people who live in New York. Besides facilitating access, they just gave a lot of really good information and support. So we've extended our outreach and community education around PrEP. In the last 6 months, we've finally seen women coming in and asking for PrEP services. And I actually wanted to share a short story with you about a client of mine who decided to initiate PrEP. So this, my patient is a trans woman. She's a Latina woman. She's in her 30s. She originally came from South America. And she's, been on hormones, actually, I believe since she was around 12 or 13 years old. I mean, it was very, very young. And she started seeing me for hormone care about 5 years ago. And she had been for a long period of time getting hormones from friends. And I've known her for quite a long time, and she's been in a relationship, with a man, her boyfriend. And it's always been a complicated relationship. And I'm thinking back of the stories she's told me over the years. And one that's stood out is, for example, one day she was very upset because she had met her boyfriend in the street talking to his mother, and he pretended that he didn't know who she was. And they've been involved for quite some time. Twice in the last year, she's tested positive for STIs and recently tested positive for anal chlamydia. And again, she's monogamous with her boyfriend. On her last visit, she shared that her boyfriend was expecting a child with a woman. And he also, and it was that disclosure about that was also very difficult for her. She also suspected that he was visiting sex workers. So, she was understandably quite upset. And, she asked me to test her for everything, HIV and STIs, which we did. And, we talked about condoms, but, she said that, he doesn't want to use condoms. I asked her about her partner's HIV status, and she said, well, he doesn't want to get tested for HIV. So we really didn't know what was going on there. And, we had a really long conversation about what her options could be. And I talked to her about PrEP. And, she was so surprised. She had never heard about it. She's like, that's something that's available. There's a pill that I could take. And you could see, she went from, I don't know what this is, to just immense interest in something that she could do to protect herself. So, we did, we followed the guidelines for New York State. We had done the screening. We did baseline lab work. It's kidney test, a urine analysis. We did, it's like a full panel. I also did a, HIV viral load. We sent that off. And we actually started her on PrEP that day. I had her meet with the, our PrEP specialists, our trans women who are working in the clinic, talked to her and signed her up. She had Medicaid. She was able to get the prescription that day. So, it's been amazing over the last few months to see how very empowered she's been around this. She's been fully adherent. She's, she's not really disclosing it to anyone, especially not her partner. But when she comes in, she's, she tells me that she's safe, and she's really, really glad that she started. I asked her for a quote. I did say I was going to change a few details, but tell her story. And she said, I'm really grateful to be on this pill and being safe from HIV. I just think there needs to be more education, and many don't know that it's out there. So I want to just go back, what lessons did we learn from this, from 2011 till now? And I think that, I think the real takeaway message is that we really didn't have a foothold, in the trans community until we made real changes in how we were providing this information. It really took us employing people of trans experience and having them throughout the cascade of PrEP care. I mean, they increased testing. I mean, our testing rates were only about 40% of our trans clients overall knew their HIV status. So everything from increasing testing, finding out if folks were interested in PrEP, whether it was something that could fit into their lives, and going through every step of the way, talking to them, counseling one-on-one, enrolling in insurance or enrolling in a PrEP app or doing medication assistance and calling up afterwards to find out how it's going. I mean, they've really been there every step of the way. And I think that, we obviously have to learn, we also obviously have to learn a lot more about, facilitators and barriers to PrEP. But I think we made a really good start. We've had, since the beginning of the year, we've had around 35 women sign up, and it's only April. So I think we're doing a good job from zero. Okay, thank you very much.